If you clicked on this video, there's a good chance you've heard about the $1 billion Medicare fraud scheme. But what you don't know is how a group of criminals pulled off one of the biggest healthcare scams in US history, and how it impacts you as a taxpayer. This isn't just a story about fraud. It's a story about greed, betrayal, and the shocking loopholes in our healthcare system. Stick around, because this story is about to blow your mind. Medicare, a program designed to help millions of Americans, became the target of a massive fraud scheme that stole $1 billion from taxpayers. But how did they do it? And why should you care? In this video, we'll uncover the shocking truth behind this scandal, how it was exposed, and what it means for the future of healthcare. This isn't just a story about criminals. It's a story about a broken system, the people who exploited it, and the whistleblowers who risked everything to bring it to light. By the end of this video, you'll understand why this case is one of the most significant healthcare fraud cases in US history, and why it matters to you. Let's dive in. Here's how the scam worked. Criminals set up fake medical companies, clinics, labs, and pharmacies that looked legitimate on paper. They used stolen identities of doctors and patients to submit thousands of fake claims to Medicare. These claims were for services that were never provided, things like phantom surgeries, fake prescriptions, and non-existent lab tests. But the real kicker? They created phantom patients, people who didn't even exist, to inflate the numbers. Over time, these fraudulent claims added up to a staggering $1 billion. And who footed the bill? Taxpayers. This wasn't just a few bad actors. This was a nationwide network of fraudsters, working together to exploit a system designed to help the most vulnerable. They didn't just steal money, they stole trust. And they did it right under our noses. So, how was this massive scheme uncovered? It all started with a tip. A whistleblower, someone inside the operation, came forward with evidence. The FBI and Department of Justice launched an investigation, tracking the money trail and uncovering a nationwide network of fraudsters. In a series of coordinated raids, agents shut down dozens of fake clinics and arrested over 100 suspects. But the damage was already done. The scheme had been running for years, siphoning billions from Medicare. This case became one of the largest healthcare fraud busts in US history. But here's the thing, this wasn't just about the money. It was about the people behind the scam. Many of them were healthcare professionals, doctors, nurses, and pharmacists, who betrayed their oath to help others. They saw an opportunity to make millions, and they took it, no matter the cost. The impact of this fraud goes far beyond the numbers. Every dollar stolen from Medicare is a dollar taken from taxpayers, money that could have been used to provide healthcare to those in need. But it's not just about the money. Fraud like this undermines trust in the healthcare system and drives up costs for everyone. It's a reminder of why oversight and accountability are so important. Think about it, when criminals steal from Medicare, they're not just stealing from the government. They're stealing from you. They're taking money that could have been used to fund hospitals, buy medical equipment, or provide care for the elderly and disabled. This isn't just a crime against the system, it's a crime against society. This isn't the first time healthcare fraud has made headlines. Here are some of the biggest healthcare fraud cases in US history. The $2.1 billion INZI scandal, a pharmaceutical company bribed doctors to prescribe addictive opioids. The $1.3 billion Forest Labs case, a drug company illegally marketed antidepressants for unapproved uses. The $900 million Millennium Health scandal, a lab company billed Medicare for unnecessary drug tests. These cases show just how widespread healthcare fraud can be, and why it's so important to stay vigilant. Fraudsters are always finding new ways to exploit the system, and it's up to all of us to hold them accountable. The $1 billion Medicare fraud scheme was a wake-up call for the healthcare industry. It exposed glaring loopholes in the system and highlighted the need for stricter regulations. But the fight against fraud is far from over. As long as there's money to be made, criminals will find ways to exploit the system. The good news? We're getting better at catching them. With advances in technology, increased oversight, and stronger whistleblower protections, we're making it harder for fraudsters to operate in the shadows. But we can't let our guard down. The stakes are too high. Despite the challenges, there's hope. Increased oversight, better technology, and whistleblower protections are helping to crack down on fraud. But it's up to all of us to stay informed and demand accountability. This isn't just a story about criminals. It's a story about us, about the choices we make and the systems we build. If we want to stop fraud, we need to work together to create a system that's fair, transparent, and accountable. What do you think about the $1 billion Medicare fraud scheme? Let us know in the comments below. And if you found this video informative, don't forget to like, subscribe, and hit the notification bell so you never miss a story. Thanks for watching, and remember, the truth is out there. We're just here to uncover it. See you in the next video.